Hello and welcome to session 44 of the medical debate. Today we're going to be discussing telemedicine and some of the ethical issues surrounding it. So firstly, what is telemedicine? Why don't you pause the video at this point and have a think? Think about the picture on the screen and how it relates to modern healthcare. Think about how you've seen telemedicine being used in healthcare and in the NHS in particular. Have you seen any changes recently regarding the COVID-19 pandemic? Okay, so hopefully you've had a chance to pause the video and have a think about that. We're going to talk now about what telemedicine actually is and the different types of telemedicine that exist. So first of all, telemedicine is defined as the provision of remote clinical services via real-time two-way communication between the patient and the healthcare provider using electronic audio and visual means. So Zoom meetings, for example, would be classed as a means of telemedicine, as would other digital means and electronic audio, including the telephone. There are three common types of telemedicine. So the first type is interactive medicine, and this allows patients and physicians to communicate in real time. So this is something like a Zoom meeting or a Skype call or a meeting where both parties are in the call together and discussing a certain diagnosis or a certain condition of a patient and discussing how that condition can then be treated. And this is the main type of telemedicine. It's the most popular type, and it's the type that's generally considered to be the most effective. The second type is store and forward, and this permits providers to share patient information with a practitioner in another location. So, for example, if a doctor is speaking to a patient and requires a scan of them, for example, a CT scan, then this information can be shared with another practitioner. For example, it can be shared from a radiologist to a GP, for example, if that GP needed that information. And this would also be classed as a kind of telemedicine, as it's involving the transfer of or the communication between a patient and a healthcare provider or two healthcare providers to try and achieve a better outcome for a patient or to try and provide treatment for a patient. Um, and this is becoming increasingly useful and increasingly popular in the NHS because a patient generally has several different healthcare professionals who are working to improve their health. And this is often called a multidisciplinary team. And therefore, it's very important for all parties in this team to have access to a patient's medical records and scans, for example. And these people may be working in different locations, so it's especially important to be able to transfer them quickly and precisely. The third method is remote patient monitoring, and this allows remote caregivers to monitor patients that reside at home by using mobile medical devices to collect data, for example, blood sugar or blood pressure. And this is particularly useful for the elderly or children or people who can't be attended to at all times but need constant monitoring. And this is an often electronic method of telemedicine, and involves taking regular scans or regular samples and giving this data to a medical practitioner or a healthcare provider in another location. And you can probably already tell that this has many advantages in terms of saving time and space and ensuring that medical professionals don't have to be constantly beside a patient in order to treat them or monitor them. So now that we've discussed the three types of telemedicine, we're going to be looking at them in a bit more detail. We're going to start by looking at the history of telemedicine and thinking about how it's changed and improved today. So the idea of telemedicine first arose in the 19th century, and it arose due to advances in telecommunications infrastructure, including the telegraph, telephone, and radio. During wars and emergencies, medical supplies and consultations were provided via the telephone. So this was a very early form of telemedicine. And although it's very different to the form we have now, it was still very useful as it allowed um, communication to occur very rapidly and for supplies and provisions and treatment to be provided very quickly and easily. In the 20th century, this started to develop, and the first radiologic images were sent via the telephone between two medical staff at two different health centers in Pennsylvania, in the United States, 24 miles apart. Consultations also became more frequent via the telephone. So patients would start to call their doctors rather than go and visit them in order to save time and money as well. So we're going to talk a bit about telemedicine today now. So currently, the majority of people have access to basic telemedicine devices like the mobile phone and computers. With improved accessibility, individuals in rural areas and busy urban areas can connect with a provider with ease. So this provides a huge benefit to people who are living in remote areas or who don't have access to a GP or a medical professional nearby. Um, these people can easily connect with others, and since the vast majority of people have access to a device like a mobile phone, this makes it easier for all people to have access to medical services regardless of where they live. Home use medical devices are also very useful as they make it possible for caregivers to monitor everything from vitals to glucose levels. Physicians can gather essential medical information and make a diagnosis without patients stepping foot in a doctor's office. And this can be very useful as it saves resources. Obviously, there aren't enough resources in the NHS to treat all patients and provide all scans instantly, and therefore it can be very useful for some patients to have consultations from their house or provide information from their homes in order to allow patients in hospitals to make use of the resources that are available. By 2020, telemedicine was expected to have a $35 billion industry. It's expected to have that much value and be an imperative piece of modern healthcare delivery. And telemedicine is still very much on that trajectory. It's growing, it's a very large sector in healthcare, particularly in the private sector, and it's expected to grow into the future. And this has both positives and negatives, which we'll discuss later. So the rise of telemedical apps and software make telemedicine appealing for patients rather than visiting their GP. And there are a variety of apps which have become available, which people can download and have on their phone, which they can use as a reliable source of checking their symptoms to see whether they actually need to go into a GP or not. And this can have various knock-on effects, including the waiting times um, at hospitals, for example. So we've already discussed a few of the advantages of telemedicine, but we'll start to discuss a few others as well in more detail. So firstly, technologies integrated with telemedical software like electronic medical records, AI diagnosis, and medical streaming devices can better assist providers in diagnosis and treatment. Streaming services are particularly useful as they allow providers to monitor patients in real time and adjust treatment plans when necessary. So, as we've mentioned before, this is especially useful in old people's homes, care homes, and when treating the elderly, as these people may often need constant 24-hour monitoring. And streaming services allow doctors and healthcare practitioners to provide this even if they're not present through digital means. Telemedicine also reduces the need for increased hospital or GP practice space and reduces the need to travel. It's economically viable and it's more efficient and productive as a result. Telemedicine also provides a simple solution to children and the elderly. So you mentioned these before with regards to constant monitoring, and it's been particularly useful during the pandemic. At this point, please pause the video and have a think about that last point. How do you think telemedicine's been used in the pandemic? And how do you think this could be integrated into healthcare as we move past the COVID-19 pandemic? Okay, so hopefully you've had a chance to think about that last point. Um, COVID-19 pandemic has meant that a lot of consultations have been carried out online. This has been especially useful because of the lack of hospital space and the increased risk of infection. Whilst people are isolating at home or during the lockdown when they have to stay at home, if GP consultations are carried out online or virtually, this can obviously reduce the risk of the virus spreading and also free up resources for people who most need them. And this can obviously be carried on after the pandemic as well, when these technologies are integrated into mainstream medicine. So we've talked a lot about the advantages of telemedicine, but we're now going to consider some of the disadvantages of telemedicine too. So before we move on to that slide, please pause the video and have a think yourself as to whether you can think of any disadvantages of telemedicine, particularly within the NHS. Okay, so hopefully you've had a chance to think about that. We're going to talk a bit now about the disadvantages of telemedicine. If any of the points you came up with don't appear on this slide or aren't discussed, please do put them in a comment down below and we'd be happy to discuss them further. So firstly, privacy is one of the largest issues with regard to telemedicine. There's still some concern about privacy laws and shared data. If patients are providing scans or images online, then there may be some concern as to who these are shared with, especially when these pictures are intimate or personal. Certain companies, especially within the private sector, don't necessarily have to comply with laws and regulations set by the NHS. And this is particularly true of applications which anyone can install to check their symptoms. Occasionally, this information isn't in line with what is recommended by the NHS, and therefore that can lead to some confusion. A lack of human interaction can also cause doctors to misjudge or even misdiagnose a patient's condition. It's often the case that doctors have to judge the physical appearance of a patient or speak to them personally and communicate effectively. And this can be very difficult via technological means. And technological errors can also occur, which might make it difficult for doctors to produce an accurate diagnosis. And thirdly, technology is expensive. Telemedicine takes a long time to set up and it's difficult to integrate into conventional medicine. This is especially true if patient records are already within the NHS and if there are multiple third parties that are providing telemedical services, it can be difficult to distribute that through all of those. So we've more or less come to the end of the session, and we're going to finish by thinking about these three questions, which sort of concern the ethical issues regarding telemedicine. So firstly, should GP consultations be carried out through telemedical means during the pandemic? Think about the advantages and disadvantages of that, especially with regard to the four pillars of medical ethics, i.e. beneficence, non-maleficence, justice, and autonomy. So have a moment to pause the video now and have a think about that first question and we'll discuss it in a minute. Okay, so hopefully you've had a chance to pause the video and have a think about that first question. Firstly, GP consultations being provided through telemedical means can obviously have a hugely positive impact with regards to economics. It's economically viable, it prevents the need to travel, and hence it can reduce infection in hospitals. So that's just some of the advantages. However, not everyone has access to devices which can allow telemedical means, and especially those who are most vulnerable, i.e. the elderly, may not be able to use them effectively and hence are more at risk. However, there are also other disadvantages, for example, the expense of telemedical means, and also the fact that doctors aren't able to effectively communicate or empathize with their patients. The second question we've got here is it ethical to replace a doctor with artificial intelligence or an algorithm? So have a minute to pause the video now and think about that second question and we'll discuss it shortly. Okay, so hopefully you've had a chance to pause the video and have a think about that second question. So firstly, some might argue that replacing a doctor with artificial intelligence would be a risk to a doctor's job. It would mean that less doctors are employed. And this is negative for many people because a doctor is obviously as a human is able to really empathize with the patient and understand what a patient is feeling, whereas that might not be possible with artificial intelligence or an algorithm. A doctor might also be able to tell if something's wrong or not quite right with a patient when it's not that obvious. And also there's obviously an error with artificial intelligence or algorithms, and then there is a question as to who is to blame if an error does occur. And the final question we've got is, should private telemedical apps be legal? You can have a chance you can have this moment to just pause the video and discuss this question with anyone around you, or write down some points if you'd like, and then we'll go through it shortly. So hopefully you've had a chance to look through the third question now. Should private telemedical apps be legal? And this links a lot to the first question and some of the negatives of private telemedical apps that we've discussed before. Um, of course, private telemedical apps don't necessarily have to align to the NHS, and therefore there can be some ambiguity surrounding some of their recommendations, and this can be one of the major disadvantages. Also, there's a risk of data being provided to unreliable providers and unreliable parties, and there is a risk of privacy issues as well. So that brings us to the end of this session. If you have any questions, please do contact us on our email, themedicaldebate@gmail.com, or do DM us on Instagram at themedicaldebate. Please also subscribe to our YouTube channel, The Medical Debate, and follow us on Instagram to stay up to date on future sessions and guest speakers. Thank you very much, and please join us again for our next session. Goodbye.